I'm Kelly Linehan. I'm an Australian registered naturopath and I specialise in brain health. I help people with memory loss or dementia, diagnosis, Alzheimer's disease, etc., go from confusion and decline to feeling themselves again. And today I'm wanting to talk to you about a well-known herb called Ginkgo Biloba. You may have heard of it and done some research already into it, wanting to find out some more information on its benefits and also the quality of ginkgo that you can buy out there and the different types that are available. It is really important for you to choose a Ginkgo biloba that has been standardized to contain specific chemical constituents, the active chemical constituents that have been shown to have the benefit on improving memory and cognitive function in mild memory impairment or dementia and Alzheimer's disease. So we'll go through firstly the actions that Ginkgo biloba have, because it's not just for brain health and memory. Ginkgo is also fabulous for numerous other conditions, and they also intertwine and interlink with memory, because memory and brain health isn't just about the brain, it's about other systems within the body, and bringing it all together to work efficiently and reduce inflammation and neurotoxicity in the brain. So keeping the rest of the body healthy is really important, and Ginkgo biloba will address numerous areas. Firstly, it's a fabulous anxiolytic and antidepressant. So it's great for reducing stress and balancing neurochemicals within the brain for antidepressant activity and reducing anxiousness and stress response. It's also a fabulous anti-inflammatory, anti-inflammatory, and also within the rest of the body. So it reduces inflammation in the body as well as the brain. It's a really strong antioxidant, and we know that antioxidants will reduce oxidative stress within the body and damage to cells as well as to tissue, like our venous tissue and our circulatory system, our organ tissue, but particularly it has neuroprotective component, and this is where it comes in handy with the brain and improving memory. So it protects neurons. It also helps to support the growth and the prevention of destruction of neurons. So it supports neuronal health, basically. And our neurons are our brain cells. So directly there with the neurons. Now, I will be just referring to my notes as we go. I mentioned that it's a cardioprotective and circulatory stimulant, and this has got to do with the cardiovascular system. So we are supporting the cardiovascular system at the same time as supporting our cognitive system, our brain and neuronal system. And these two go hand in hand. We know that cardiovascular health is directly linked to brain health. There is a type of dementia called vascular dementia, and particularly in vascular dementia, Ginkgo biloba is going to be a fabulous option for healing the brain. Then it's also neuroprotective, neurotrophic. Now, neurotrophic has got to do, I've already mentioned it, got to do with the supporting the neurons in the brain to grow, repair, and keep their life. So longevity of neurons in the brain. Nootropic, we've all heard this particular element. It's been quite a popular term these days in the health industry, nootropic. So it is also a nootropic, which increases cognitive health. It's a cognitive enhancer and a venoprotective. That just means it protects the venous system and the veins and artery walls, etc. And that's got to do with its antioxidant activity as well. So its main use here is got to do particularly with the small vessels and the veins within our body. And this directly links up not just to the cardiovascular system, but also to tinnitus and hearing. All the blood vessels in the back of the head and the ears is where it's helpful for tinnitus. Now, they have linked tinnitus with cognitive decline and dementia. And so this has a double bang for your buck here, actually triple bang for your buck, because you're getting cardio protection, tinnitus protection, as well as neuronal protection for the brain, and a circulatory stimulant and antioxidant. Let's look at the clinical trials now and the different forms as well that are available to you on the market. So first, the capsules and tablets that are available, liquid extracts and tinctures that are available, and teas and powders. It's important to choose the right type. So what I want you to look for when you go out there to purchase your product is 24% of a particular chemical constituent called flavone glycosides, okay, and 6% of terpene lactones. These two are the clinically trialed constituents found in the ginkgo plant, the ginkgo leaves, that have been shown to be effective for proper cognitive function and improving circulation and antioxidant and anti-inflammatory activity in the brain. The liquid extracts that you source from a practitioner, such as a naturopath, that have all been clinically tested and lab tested, third-party lab tested, so independently tested for these chemical constituents to fall within those ranges that I've just spoken about. Brands like Mediherb here in Australia, and there's Herbal Extracts Co. and Optimal RX. There's numerous naturopathic prescription-only herbal extracts that I would highly recommend you source through your naturopath, someone like myself who can prescribe them for you. It's important to note that getting a prescription from a healthcare professional is a more advisable way of going about getting your supplement for Ginkgo Biloba, because it can also have interactions with medications. Now, medications such as blood thinners or other medications that interfere with platelets or blood viscosity will interact with Ginkgo Biloba. So you'll want to double check with your healthcare practitioner or your doctor before taking Ginkgo Biloba if you do take any of those medications, or if you have any blood thinning disorders, okay, that reduce your clotting factors or your ability to clot. All right. Then there is teas and powders, which I highly recommend you don't go for. The teas and powders are really difficult to standardize. They're usually much more variable in their active constituents, and they won't even state exactly what constituents have been tested or what's exactly in them. It may just state that it's Ginkgo Biloba leaf powder or Ginkgo Biloba leaf 5,000 milligrams or something like that. You want to make sure you see the active constituents broken down and standardized to contain 24% flavone glycosides and 6% terpene lactones. Now, there is a clinically trialed extract that you can purchase called EGb 761. This is in a few different products on the market, so do look for that particular extract of ginkgo, EGb 761, and it has been standardized to these levels that we've just been speaking about. And let's talk about as well here the different studies that have been done specifically for dementia and mild cognitive impairment, because there has been multiple meta-analyses that have been done on ginkgo, particularly recently, 2025. There's been some trials that confirmed these particular standardized ginkgo biloba extracts produce real improvements in cognition and daily function, as well as quality of life for early dementia and mild cognitive impairment. There was a systemic review, particularly on amyloid PET positive mild cognitive impairment, where ginkgo biloba extract improved cognition and daily functioning and appeared to also lower the risk of conversion to Alzheimer's disease at 12 months compared to cognitive enhancing drugs. So that study showed really that it was actually more effective than other drugs on the market for mild cognitive impairment and dementia. Then there's also been other cumulative results from placebo-controlled meta-analyses. There's been over hundreds of patients that showed ginkgo significantly benefits cognition, as well as global assessment and quality of life, with a safety profile that matches placebo, which is a good thing. So the two things you need to just keep in mind with the safety aspects of ginkgo is that it can thin the blood and have an effect on platelets. But there's also been a couple of long-term trials. One particular one, there was a major European study found that Ginkgo biloba reduced Alzheimer's incidences in elderly adults with long-term use of the standardized extracts. So these are the extracts that are in things like Mediherb tablets or Mediherb liquid extract of Ginkgo biloba, or the EGb 761 extract that I was talking to you about. Now, it's excellent for tinnitus as well. Tinnitus, it has been clinically trialed for and has shown that it helps with microvascular insufficiency. And we know that microvascular insufficiency is one of the main contributing causes to tinnitus, as well as it contributes to the development of dementia. So we know small vessel disease and impairment within the microvessels of the brain and the ears impact the production or the development of dementia and mild cognitive impairment. And there has been clinical trials done for tinnitus that has shown its effectiveness for reducing tinnitus symptoms. Now, this obviously overlaps with the vascular health improvements that are seen with Ginkgo as well, so for the cardiovascular system and for inflammation as well. So reducing inflammation in the brain will help with cognitive impairment and improve memory symptoms. Okay, so we'll wrap it up here. If you have any questions, feel free to reach out to me here or via my socials. I do have a comprehensive program and protocol in place that addresses all underlying aspects of cognitive impairment and the development of dementia and treatment of dementia. It doesn't just address Ginkgo biloba, and Ginkgo is an amazing herb, but it's only one piece of the brain healing puzzle. There's numerous other components that you want to address because there's so many factors. It's a multifactorial disease, and you need to address all underlying reasons for your particular development or presentation of mild cognitive impairment, dementia, or Alzheimer's disease. So feel free to get in touch if you want to learn more, and see in the description details on my full comprehensive step-by-step online protocol called the Brain Revival Protocol. And we'll see you in the next video.